CAMH has decided to go tobacco-free, and the reasons for this is because we want this space to be healthy for patients and for people who work here, as well as for visitors who come onto our property.
CAMH is taking its smoke-free policy to the next level. Like many other hospitals throughout Canada, the US, and around the world, CAMH is going tobacco-free. A move Dr. Peter Selby says will save lives. Tobacco dependence is the leading cause of disease and premature death among our patients.
We want to start paying attention to our patients' lives and what is killing them. And we realize that there are many things that go along with leading a healthy life while you have a mental illness. And you shouldn't die of your mental illness or because we fail to attend to your physical health at the same time.
Dr. Selby says going tobacco-free is not about changing rules, it's about changing culture.
And when patients come here, many patients have told us, many of them have been in jail, and when they're in jail, they quit smoking. But then they come back to a place like CAMH for treatment, and because the culture sort of promotes smoking, they'll end up going back to smoking. And they find it really odd that they come to a hospital, after all, we are a hospital, and they go back to smoking in a hospital. And that seems really ironic to me.
Our journey to becoming fully tobacco-free is now underway. This means designated smoking areas will be decommissioned. CAMH staff, outpatients, and visitors will not be able to have any tobacco products visible at CAMH, and inpatients will not be able to bring tobacco onto the units.
We have had major problems with contraband tobacco being brought onto units, lit up and causing fires, which have put people at great harm. Without tobacco there to cue people to crave, to go out and use, you actually see symptom levels of our patients, clients decline substantially in a tobacco-free environment. There is less aggression, less seclusion and restraint, less use of PRN medications, shorter lengths of stay, and overall higher ratings of satisfaction.
This new tobacco-free approach is based on research from experts in the field like Dr. Doug Sedonis, Chair of Psychiatry from the University of Massachusetts Medical School.
I started in the mid-'80s being interested in this topic as a young doctor being trained to give cigarettes out to patients for good behavior.
Dr. Sedonis is now traveling the world, helping treatment organizations become tobacco-free. During a recent visit to CAMH, he shared research which shows most patients are welcoming the move.
They say we're stigmatized for having mental health problems. We also are now, culture is stigmatizing us for smoking, and we feel that it might affect us getting a job or having a relationship. And so it's the patients who are raising it as issues.
This is about the health and safety of our clients, our staff, our visitors, because we want to be, and we are, one of the leading evidence-based psychiatric and addiction facilities in the world. And this will, help us to really promote the goals and values that we have set in this organization.